Localized prostate cancer is highly curable, and joining us today is our Live Well partner, Dr. B of the Prostate Cancer Institute of Arizona, to talk about how they can help. And Dr. B, I love this that we're sitting here talking about this because I am big on men's health, especially when it comes to our prostate, especially when it comes to us talking about it. I know a lot of people feel very cringe that we shouldn't, but this is so important, but also important is getting it cured when you do come down with prostate cancer. But we got to mention localized prostate cancer and explain a little bit what that is.
Yeah. Well, first of all, prostate cancer is the most common malignancy for men, other than skin cancer. But when it's found in the earlier stages through screening processes like a blood test with PSA, it can be found when it's just localized without being spread throughout the body. And when it's localized just contained within the prostate, it's highly curable with a variable array of treatment options.
Yeah, and this treatment that you do actually was done way back, actually, that was being done, but because we can say it, that medicine got more of, how can we say, profitable in a way, they started to really take it back a little bit. But you said, I need to bring this back because you want it affordable for men to take care of their prostate cancer. And also, it's something that you've been doing for years.
Yeah. Low-dose rate prostate brachytherapy is the most conformal radiation treatment for prostate cancer, but it's gone away for the wrong reasons. And that's why it's my mission to revive this treatment for men in this community. It's an ideal option for many. It's a one-time treatment done in the operating room, less than an hour. You go home the same day. There's minimal downtime, and also has the highest erectile function preservation rates.
Yeah, and that's important because we know that other treatments, again, you're not knocking those treatments. Those are good for some things. But as you said, the downtime is sometimes that's where us men, we worry about our downtime because we want to get to work, we want to get to work out, we want to, of course, be with our partner, and that scares us to go get these kind of treatments done. So that's why you're saying this one that you've been kind of like bringing back is very helpful.
Exactly. And there's not one treatment for everyone, right? It's just that this option be available, and it really hasn't been available, and that's really my goal now. Men should have the option to choose what's right for them, and there's not one right answer, but I would like to make sure that low-dose rate prostate brachytherapy is an available option for the men in this community.
Yeah. What's also important too is the years that you've been doing this, because this isn't something that you spend only a couple of years in medical school learning and going to do it, and you've been doing it for how long now?
Yeah. Been doing it for 20 years. Wow. It is a very highly skilled procedure. It's not something that you can really learn over a weekend course, and and that's been one of the struggles of trying to revive this treatment because there are very few people trained in it.
Yeah, and that's why you sit down with them, you talk with them, you counsel them, and not just before, but after too, to make sure they're doing well.
Of course, we want to make sure that the treatment is as effective as we explain to them. And generally, men have a fairly uncomplicated course afterwards.
That's good. And again, this is something that we should be talking about, and that's one thing that you have been saying is that, you want men to really recognize their self, problems with, of course, the prostate, which, as you get older, it happens, but we're also seeing it in some younger people too, right?
Yes. There are different risk factors. Such as, being African American is one risk factor that they should be getting screened earlier. But it's really going to your doctor and being proactive about your health. And if you go and get screened, there is a much better chance of being cured from this treatment, from this disease, rather than having a much more worse outcome.
Yeah, so we're so happy that you're part of our Live Well program because that's where we are here to take care of everyone to make sure they are living their best lives, which is great. And so how can people talk with you, see what they can do and see what you could do for them when it comes to, of course, prostate cancer and other things too? So how can they get a hold of you?
Well, we have our website, we have our phone number, feel free to call us. Again, we treat men with a diagnosis of prostate cancer and looking for other options that they have not been available to them. And we specifically, the only practice that exclusively focuses on low-dose rate prostate brachytherapy.
That's perfect. Thank you. Doctor, thanks for coming in and talking about this. I know it makes people feel uncomfortable. I'm so glad we're doing this because, again, men's health is on my 2023 goal for everybody. So we
make sure you get checked.
I did. I have. Yeah, it's very important. So thank you very much, doctor.